My name is Janie Webb, and I just finished a practicum for Liberty University for my Health 698 course. I worked with Hype to Empower Atlanta, a nonprofit located in Atlanta that serves individuals with HIV. Despite concerted public health efforts, an estimated 40 million people are currently living with HIV/AIDS worldwide. HIV/AIDS is often thought of as a pandemic that happened in the late 1980s, but deaths have increased from 1980s and have reached a height in 1995. Deaths still ensue, with over 1 million people dying from HIV/AIDS in 2019, and with an all-time high of 3 million in 2004. The purpose of this practicum was to make an impact in the lives of individuals with HIV or those at risk of HIV in Atlanta, Georgia. At the end of my practicum, I was hoping to create a toolbox for creating video narration and present an educational presentation to participants, increasing video narration knowledge by 70% as evidenced by pre and post tests. I also hope to complete one government grant, increasing funding by 10% of the overall yearly budget. I also hope to complete an evaluation program by the end of the practicum, improving the health literacy of participants' digital community by 10%. I had several accomplishments during this practicum. Not only did we create one grant, but we did do two as a team. It was a collaborative effort. So we completed as a team the Ryan White HIV/AIDS program Part A, HIV Emergency Relief Grant Program. I assisted in editing this grant document, and I also created a logic model, and I created the evaluation plan as well. Our second grant that we completed as a collaborative team was the Coordinated Community Health Navigator Hub, Partnerships to End the HIV Epidemic in the U.S. Not only did I edit this document and help draft it, I created a theory of change model, a logic model, and an evaluation plan. In addition, I worked on the figures program, and I created the goals and objectives, drafting them for the program document. I created a logic model, and I created an evaluation plan for the figures program. Currently, even though I'm at the end of my program, I am working on the curriculum for the figures program and tying them to health behavior theory and education theories, which is an important thing to do to obtain funding. Funders want to see that your program is tied to health and behavior theories. Some challenges that I did not anticipate in this practicum. I did not realize that the practicum would be tied to a project paper. I was surprised, actually. I thought I would just be working and not working on a final paper. I don't know if there would have been a better time to take this course, but if I lived in a perfect world, I would take the course when I didn't have to work as much and not during holiday breaks, which are challenging with other competing things to do. I learned many lessons during the course of this practicum. Probably the most significant lesson I learned was how the program goals, the logic model, and evaluation plan are all connected, and how creating goals and objectives and creating a visual for the logic model affects the evaluation plan and helps you see the tools that are needed for assessment. With the evaluation plan is an attempt to measure the objectives, and how important it is to disseminate this to stakeholders, and then to have the ability to adjust your program activities or objectives as you see fit once the evaluation is complete. I didn't do an actual evaluation. I wrote the plan, so it'll be interesting to hear how it works, and hopefully it will be a beneficial tool. I realize that in the future I need to be more organized and intentional with my paper writing activities, especially creating the annotated bibliography. This really, I think, is the most crucial assignment of writing the practicum paper. In hindsight, I would devote more time researching and creating those annotated bibliography, writing those summaries. I think this would have been a helpful tool to be able to take and write different sections from those summaries, and to be able to organize my paper better with a really good annotated bibliography. So in the future, I would spend a lot more time on that. Also, in the practicum, in the future, I would ask more questions of the director. He would be real fast when he was given directions and assignments. So I think that in the future, I would slow down, ask questions when I didn't understand, and not be embarrassed to ask questions, to have a complete understanding of what I was expected to do. That way it would cut down on inefficiency and doing things that weren't necessarily as he instructed or what he was thinking of, what he was wanting. All in all, it was a really beneficial practicum. I would like to have been more organized, but I did learn a lot, especially how the goals, objectives, logic model, theory of behavior change model, and the evaluation plan is tied together. And when you have those aligned, how it is easy to create a really good sound program, and then have a sound evaluation plan. So it was really a beneficial project. I also learned a lot writing the paper, realizing why to do the annotated bibliography, and just now looking back, knowing all the pieces better, and I think I would do a better job and be more efficient in writing my paper if I had to do it again. So I learned a lot. I enjoyed the course. It was very challenging working full-time, writing a final paper, and working extra, but I do believe that it was beneficial and added to my public health knowledge. So I appreciate all the patience and instruction from our instructor. So thank you for the opportunity.